BRAF-mutant colorectal cancer is a tumor subtype that we've made a lot of advances over the past several years, and it's certainly changed a lot over the course of the last 10 years. We've recognized many years ago that patients with this particular mutation did very poorly with standard therapies and had a very short life expectancy. It was estimated a survival of about 12 months in many series. Fortunately, progress has been made in this area, and novel therapies have been developed, and we're starting to extend the life of these patients.
BRAF mutations occur in about 8 to 10% of metastatic colorectal cancer, and the vast majority of BRAF mutations are BRAF V600 mutations. These lead to inappropriate activation of BRAF signaling and activation of the MAP kinase pathway. There are other mutations other than BRAF V600 mutations that do occur in colorectal cancer. They occur in about 2% of cases, and these are what we call either class 2 or class 3 BRAF mutations. These both act and respond quite differently to current drugs and really need to be thought of separately. And the reason that BRAF mutations are important in colorectal cancer is, number one, they actually affect the prognosis of colorectal cancer. BRAF V600 mutations specifically confer a tremendously poor prognosis with almost a twofold increase in mortality relative to BRAF wild-type patients. Interestingly, however, the 1 or 2% of colorectal cancers that harbor some of the non-V600 mutations, particularly the class 3 mutations, actually seem to have somewhat better prognosis. And so the exact mutation that occurs in BRAF is quite important. And the second reason that BRAF mutations in colorectal cancer are important is that they actually are starting more and more to lead to new therapeutic options. And most of this research is actually focused on targeting the most common BRAF mutation, BRAF V600, but there's actually now some emerging data to suggest that other mutations, such as class 3 BRAF mutations, may actually respond better to some of the standard therapies, including anti-EGFR antibodies.